As many of you are aware, the time frame for when reports need to be updated, recertified, has changed. So the state of Colorado home care licensure requires reports to be written every 60 days. We've filed for an exception to this rule and requested that reports be due every 90 days, which would put us in compliance with the new Medicaid regulations, which require reports to be written again every 90 days. Both entities require that those reports be signed by the PCP, primary care physician, for that patient each time, so every 90 days as well. What we're asking you to do is, as of today, every patient, your certification period be for 3 months or 90 days. Any reports that are currently in place that have a 6-month time frame, you don't have to do anything with those. Simply, when those come up due again, recert them for that 90-day time frame. Of course, you have to be able to justify the medical necessity for continuing that treatment plan into another cert period. Now, the one exception is for PTs and OTs. If it's a PAR patient, and you're already aware of this, you'll need to do those reports for 6 months because our PARs are lasting for 6 months. But you update that plan of care within that time frame at the 90-day mark. And then we also get that report signed by the PCP. We do indicate that to you on your PAR tracking sheet so that you know when your reports are due. But if there's questions about that in particular, please give me a call. Now, when you send in your reports to the reports.logs@theats.com email address, please make sure to CC the service coordinator if that's applicable to your patient, especially if they're in that 0 to 3 early intervention population. It's really important that those service coordinators get each of your reports. So just CC them on the email and then put in the body of that email what patient this report is for. If you don't know who your service coordinator is for a particular patient, please give us a call at the office. That information would be on your patient information form that you get when you first accept that referral, but certainly we can help you track down that information, as it's really important to know for every patient. So let me just reiterate what we're asking you to do. Your reports would be due every 90 days from this point forward. Send them into the reports.logs@theats.com email address, which you're already doing, and just CC the service coordinator. It may be helpful if I give you some information about how it works in our business office. We work really diligently to make sure that every single one of our therapists is in compliance with all of the regulations that we face with the services we provide. So when your report comes into us, we check to make sure that it's been CC'd to the service coordinator. Then it's printed down and faxed to that primary care physician with requesting a signature. As soon as we get that back from the primary care physician, we file it in the patient's chart. We track very carefully when we get reports back, and if any are outstanding, we make sure to track those down from the primary care physician, so you don't have to worry about that. Now, the reason why it's so important that your reports get in on time is for this reason. When an auditor comes in to look at your charts, what they're going to look at is that each date of service, when your SOAP note, is underneath the umbrella of a plan of care. So let me explain that. Let's say I wrote a plan of care dated January 1st for 90 days. So it would expire on April 1st, 2011. Okay? Now, and I sent that into the office, and I CC'd my coordinator. It's been signed by the PCP. I'm providing treatment in this time frame, and I'm completely in compliance. Documenting, of course, exactly what I'm doing in my sessions to justify what I'm coding, because that's also what they'll look for in an audit. Let's say I'm late getting my report in on time when this one expires. Let's say I completed on April 6th. So that one would expire on July 6th. Now let's say I continue to treat my patient and I happen to have a visit that's outside of this time frame and outside of this time frame. So let's say I treat my patient on April 3rd. Now the problem lies is any visit visit I completed under this umbrella has the PCP's stamp of approval by their signature on what my plan of care says that I'm working on in those visits. Anything under this umbrella is covered as well for the same reason. But this visit is not covered. And that's a real problem during an audit. So, for this reason, we're asking that you diligently track when your reports are due. If you don't have a way to do that right now, call me. I've got some ideas that might work for you. Also, we're asking that your reports get in 1 week prior to their expiration date. That gives us time to send it to the PCP and get their signature so that any of the new visits would be covered under that plan of care in that time frame. The PCP dates the date that they sign it. That's why we would need it prior to the expiration so that any visits that would happen the next week or whenever would be covered under that time frame. I know this is a bit confusing, but if you have any questions, please call me. I'm more than happy to talk you through it, explain it, and help you set up your own system. Thank you so much for all of your hard work. We really appreciate what you do, and we're exceeding at keeping you all under all the current regulations and keeping up with the changes. So, talk to you soon.